Delighted you could drop in with us. I'm Scott Mitchell, along with Mr. Dismukes, and we are here right now. I don't even have mics muted right now. Can you believe that?
Hey, actually, we did pretty good on that one.
That's not bad. So we're suffering from, one of us is suffering from red cedar fever, which is just makes you just unmanageable. But anyway, glad you're with us on this Wednesday night as I kind of turn this mic around in this camera. Jeff Dismukes with Oklahoma Department of Mental Health and Substance Abuse Services. We got a pretty good segment for you tonight, starting off with Commissioner Brian Maughan. And, we've been following the situation with the Oklahoma County Detention Center, starting with what's been done to the facility. But pretty much every single expert I know that is of stature in the state that is in this particular field, from criminal justice reform to from behavioral health, has said that building's got to go. We got to change things. And the guy who's been working the hardest on this to try to put together the funding on this has been Commissioner Brian Maughan. It's really fallen right into his lap to put this thing together. And we were just playing for him just a minute ago. Commissioner, good to have you here tonight.
Thank you.
The last time he was here, we went into the process about all of the buckets that have been needed to be filled to make sure this gets done. And we've had interviews with the CEO of the Greater Oklahoma City Chamber of Commerce, Roy Williams, Chairman Chris Kennedy, who's been working on the issues at the state legislature. I mean, everybody in town has been working on trying to make this facility good, pay for this facility, and there's some deadlines. I mean, as you said some time ago, I believe your quote was, "This is the best opportunity that the citizens have ever had. Fill the rest of it in."
Yeah, probably the most pragmatic solution we've been able to bring to the table in at least the past 2 decades. And it's, of course, a 30-year-old problem. The jail opened in 1991, very infamously, with a lot of problems almost day one. And, the issue has not been about the concept of we need to build a new jail. It's always been about how we're going to pay for it. That remains the challenge. Now, we had some advisory council that we hired from a private consulting firm who's helping us go through these ARPA dollars, the American Relief Plan, that was financed to us by Congress. And it comes with a lot of guidelines and some restrictions that were in the Federal Congressional Act, including ever-changing guidelines. And so, for instance, the consultants told me the other day they thought it was literally 31 times the federal treasury changed the guidelines on the CARES Act, which was the first round, if you'll recall, of money that we had to work with. So everyone is proceeding with extreme caution when it comes to these dollars, because you have to make absolute sure that you're not going to do something that binds future elected officials and the taxpayers ongoingly into some sort of litigation or where you have to pay restitution. At least we're going to make every effort. There are no guarantees in this world, but we're trying really to hang our hat on a solid nail of legal guidance and from those that are experts in doing this all across the country.
So you've got consulting firm hired, which is trying to help you understand federal regulations that are moving all the time. And that's anybody that's ever done the corporate taxes understands how that moves around.
Right.
But you didn't have a lot of margin there, right? I mean, you're having to get exact amounts here, exact amounts there to try to pull this thing together to make this happen. And my understanding is that we may have a bit of a hitch.
Yeah. So you remember, I think when I was on this episode last time and shared with you on your series about everything has to go exactly right. And in politics, that's asking a lot. And so it's still the case. But we have, I think, great opportunity still. It's a bit of a hitch in that the latest guidance from Treasury came out that was a little more restrictive than we originally anticipated. That's true of every bit as much for the state as it is for the local entities that are dealing with this. Counties all across the country are considering this very issue. We're not alone. So there is others that are pursuing this, but they're generally coming up with the same idea that a lot of this will have to be spent very specifically and on the things that merit for those guidelines. They include infrastructure, they include things that are, of course, related to COVID and how to stop the prevention and spread of it. It also includes tourism. So there's another things of economic development. But what it can also include is supplanting your budget with other things that you use that we already have tax collections for to pay. We might can relieve those funds, and then those funds that aren't obligated by federal guidelines could be then theoretically freed up and used for, the construction, for instance, of a new jail. Now, that having been said, you still don't want to do anything that's hinky or anything close to the edge of unethical. So, again, we really want to work on getting that guidance very specifically, line item by line item, from this consulting firm that's named Accenture that we have hired to help us with that. If you're in layman's terms trying to maybe process and understand it, think in terms of like H&R Block to assist you with your taxes. But as you suggested, with corporate taxes, much, much more convoluted. And we have some really experienced people with the county that have had decades of experience with dealing with federal grants, particularly with the Justice Department that we've used for the jail. So we don't bring just a lightweight bench to the table to even talk about this. And yet all of them got submerged in the convolutedness of this federal act that they immediately stepped back and said, just we'll be the first to admit this is above our pay grade. So we wanted to get people who really felt like they knew how to do it. Now, to reassure your viewers, though, I don't want to come across as defeatist. I think this was just another challenge. Someone on my staff said this is just that ever cursed jail. Nothing about it has been simple, but that we may be able to find other things. And of course, we're anticipating moving forward with a bond election that I think will likely be held this summer. And, that's going to address a big chunk of the dollars. So we're just looking to see where we can get the other pots of money to round out the total equation of what's needed.
Also, you had mentioned that, the clock is ticking on some of these things, right?
Yeah. We've got to call the election for one, especially if it's to be held on the primary ballot at June 28th, which was something that I certainly was hoping to do. And we'd have to call that election sometime within the first week or so of April, no later. But there's the, again, pragmatic side of that as well. Eventually, at some point, you have to run a campaign. So you don't want to wait just too late where you don't give yourself time to go out and have advocacy and, public town halls and stuff like that where we can talk about it.
Any idea if you get everything that you're in your buckets that you're trying to fill with Chris Kennedy and the chamber and all the folks that are working on this, are you closer to understanding what that building needs to look like and how you're going to handle issues like behavioral health, things of this nature? I know those are always controversial.
Yeah, well, very much so. We're going to have to work, of course, on trying to get a mental health facility component built in with this. That is one of the problems we've had, trying to make sure that everybody's adequately housed in the right category. It's a one-size-fits-all facility the way it is designed right now, and it's also designed as a maximum security facility. Both are very flawed. They were flawed 30 years ago. As frustrating as that may be, that's the situation we inherited. So again, just trying to work our way through with things that we have at our disposal to fix the existing restrictions that just by design has limited us to. So clearly we know what we need to do with the new facility. I think also there's a great opportunity to work with Oklahoma City, who has had a lot of experience with building things, with maps. I think that there is a potential partnership for voter confidence as the taxpayers are considering about making this investment. I think it's absolutely essential that we assure them that we're going to work with entities that have a lot of background on making sure that it's done right, that no shortcuts are taken, all of which were issues that were, of course, dealt with in this building opened in 1991.
All right, let me shift away from that. But before I do, the basic thrust is you're looking at the next couple of 3 weeks are going to make the difference in terms of decision making on the bond program, correct?
Yeah, and I really want to thank you and your viewers for giving us the chance, because we can get into it. It's so hard on a news segment to just explain this complicated scenario in a 30-second soundbite. Your programs are always so meaty with substance and allow us to really get into these topics. You offer such a tremendous service to the viewers, and I encourage everybody to watch your show for those reasons. And I think, are going to hopefully have a lot more to bring to the table, and I hope you'll have us back to be able to discuss it further.
Well, 102 or 103 days to the primary.
Right.
So, that's just like that in terms of campaigns.
Absolutely.
All right, so we'll be. And by the way, our from Dismukes and Nile say, yeah, anytime that you folks want to come talk, and we're going to spend. I know that you have to go in just a moment, but we're going to get back into why this is so important when we're talking about health issues, behavioral health. This has got to happen, and that's not even being. I'm just not stepping across the line there. I mean, every single person I know that is in this field, criminal justice reform, behavioral health, overall health, say we've got to do something in this particular facility. One of the things that you do is you've really worked on some programs, including Shine. Also, now you're working on a community gardens project. You're doing things down there at the county that not getting a lot of publicity, which is not unusual. Bad news travels the fastest, of course. But you're working on ways, and by the way, we have a couple of stories we're going to share from Griffin tonight about things that happened today in Oklahoma that are good news. But you're working on ways of helping people that really need the help right now, the hand up instead of the hand out, right?
Yeah. So, I think you're referring to the Shine program, which if you can believe it, it'll be 12 years old next month that we started, which was just an alternative sentencing program at first to reduce jail by having them serve time on our public works crews rather than, being in jail and not paying their taxes, not seeing their kids or being a part of their family unit or keeping their jobs. So we used them originally for graffiti removal and some bar ditch cleaning and picking up trash and debris around town. But it's grown to be so much more than that. And in particular, last year, we started a pilot program for community gardens. We started with 3, wanted to be sure we were armed with success. And then this year, we've at least got 12. We're talking today about a 13th location. And what is happening with the pilot program last year has already exploded before we even put the seeds in the ground this year. And the number of different governmental entities, which include schools and cities and parks, but also neighborhood associations, master gardeners, senior adult classes at church, and youth groups are coming forward to see what they can do to assist. Well, every stakeholder that comes and sort of adopts a garden, if you will, has expanded our bandwidth. So the more we've been able to bring online, the more we've been able to do. All thanks to a philanthropist named Susan Bergen out of Norman, whose passion is to provide these community gardens. So she provides the rich topsoil, the plants and seeds, as well as the gardener, which I need because I don't know exactly how to do all this in the right seasons to plant. And then Shine crews go in there with these sentenced to community service and do some of the manual labor, which is planting it, tilling the ground, helping pull the weeds and water. All stuff that my 90-some-odd-year-old grandma did up until her death and loved it. But it's work. It's work that was frequently from the Greatest Generation era that we think about with victory gardens, but it's a lost art. And we're trying to do it in these food deserts, targeting them specifically. They're underprivileged neighborhoods, servicing, a school that has a real impoverished population so that parents, students, and neighbors alike can come up there and just freely pick this produce. We're also working to see if we can do it. The deal I was working on today is possibly doing something that would allow the juvenile center. We talk a lot about the adult detention center, the big jail downtown, but we also are charged with the juvenile center up there close to the Chesapeake campus off of Classen. And so they're there 24/7 also with a number of residents that are in there incarcerated, waiting trial, that are deemed that can't be safe out there. So we're looking at bringing in raised beds and having opportunities for them to work and perhaps generate enough produce to help reduce the grocery bill at the juvenile center, but also giving those young people some opportunity to be outside and get some vitamin D.
That's great. That's a great program.
Yeah.
Give them a skill too. We're helping so many of these people get a skill. It's not been uncommon for us to hear after the fact that a number of these Shine participants have gone to work for landscaping companies. And now we're hoping that, they may have something to be able to bring home to their family as a benefit if they learn how to garden and be able to do little gardens in their own home to help with their grocery bills.
Will there be any red cedar trees in your community gardens?
No, but it's funny you should bring that up because yesterday I appeared at the City County Health Department where I've asked them to also partner. They've been a partner with us, as you know, in the past. And you might think that's a strange bridge, for some sort of an alliance. But, as you pointed out, I think you're suffering from the red cedar pollen allergies are just out of control. This wind, for instance, today is a real culprit. Not in and of itself, but because it carries with it those allergens from those just terrible parasite trees, red cedar. And I said to the City County Health Board yesterday, you wonder why I come ask government for assistance on this deal when it involves most of the time private land where these are growing in droves. And it's because government is who did this to the people. It was the response of the Roosevelt administration to the Dust Bowl nearly 100 years ago, where because they proliferate and reproduce so quickly that they decided to do this for soil erosion. Well, in that respect, they work and they do provide a windbreak, but they have overtaken livestock and harvest are damaged now. It's an economic deterrent to our agricultural economy. It is also an allergen. Most of the AMPM clinics tell me it's not because of some of the things that you may think that clog them up. It's really just this more routine problem. If you ever have company that come in from another state, usually a day or two later, they're like, gosh, I just never had problem with my allergies like I've seeming to here in Oklahoma. And so it's also a deterrent for tourism, believe it or not. And then their explosive red cedar sap is explosive, combustible actually. And then they can take up to 80 gallons of water a day. So it's not that our lady neighbor Johnson can't go out and water her petunias for lack of not having originally had enough water. What the issue has later become is that these suckers have just literally drained it out of the water table to the point that we're rationing people from being able to water their flower beds to every day or 2-3 days.
So here's the symptoms. This is a real public health problem. Itchy, watery red eyes, nasal congestion, runny nose, sinus pressure, sneezing, sore throat, fatigue. And also the inflammation triggers may also raise your temperature. It's probably past time for us to start taking it seriously. It's bad. It's not good.
Very serious. And I'll highlight just a couple of more points is that yesterday I showed data to the health department board about how they're a big harbor for both ticks and mosquitoes. We have really determined they are a big nest for mosquitoes. We've always been worried about those tires or pots and flower pots and stuff that may have collected a little pool of water. We didn't know that they had gravitated so much to these red cedars. There's new information and studies showing that. Well, as we're battling West Nile, before COVID, we had other things we had to worry about too, and West Nile was increasingly one of them. And so that's an issue, as well as just when you think about how many acres. I pointed out to them, people say, well, I just can't believe you're not able to get a yard man or somebody to go out there with a chainsaw and take care of this. Why are we helping private property owners deal with this? Well, not only did we, after just issuing 2 press announcements about to have this program, have a 4-year wait from people immediately responding, which I think clearly demonstrates the need. And economically, it was so prohibitive for them to address it themselves. But that when we arrived to do it, we were often targeting parcels that had between 50 and 150 acres of them pretty much just completely taken over, meaning there was zero chance for livestock and certainly no opportunity for harvest.
I know when I've seen you on those trucks at fire season, which we're in one now, when you see those suckers burn, it's unbelievable how many BTUs are in those trees. They explode, Brian, from the stuff I've seen.
I have been with experienced veteran firefighters, but maybe more from an urban area that have helped us in response. A lot of these rural areas, it's another point I made to the health department board yesterday, is that, the rural areas aren't equipped not only with the infrastructure of the fire plugs out there, but they just also don't have the volunteer fire departments like they did back in Petticoat Junction days. That's kind of also a lost art. So we really are dependent on outlying surrounding areas coming in and assisting us. And when they get there, they may have really been versed in mostly urban firefighting. And when they hear those guys, I had one particularly who swore to me it had to have been a car explode. He said somehow fire has gotten like what happened with Chick-fil-A a couple of weeks ago when fire gets underneath the gas tanks, the cars blow up. It was not. It was one after one after one, and they nearly sound like a sonic boom. Not really too much embellishment there. They are incredibly combustible.
Do you know the words to the Petticoat Junction song?
I knew you were going to ask.
Yeah.
Not off the top of my head.
There's a little hotel, the junction, called the JD. I don't know what it was called. I can't remember.
Probably could do Green Acres. But
Green Acres is more well-known. So
yeah, right.
Well, it's great to see you. And thanks for the update. This is the sort of news that travels fast. It hadn't traveled fast today, the last couple of days, since my sources started talking to me, but it was it's something that's it's encouraging. Actually, there's a bump in the road. You got some time to solve that, and you've got a great team. There are some really, really wonderful people in this county and outside of this county too, by the way, that are working hard to do this. And we're going to spend the next few minutes. We're going to let you go and get on with your evening about why we have to do this. But there are some really great people that are working really hard to find a solution. It's like a Rubik's Cube, right?
Absolutely. And I never want to leave one of these interviews without saying my thanks to all those volunteer citizens who have stepped up and served on the Blue Ribbon CJAC Committee, the Criminal Justice Advisory Council, and particularly the Jail Trust. They could be anywhere in the world, particularly this week on spring break. And they're all around tables dealing with this, meeting with people, and taking home tons of homework. I cannot stress to you the volume of literature and reading that goes with this job. And I just thank them for caring enough about our community to serve completely free of charge.
It's my understanding there have been hundreds of people racking their brains the last 24 hours trying to figure out how to get across this. And it's really underreported, but the fact is it's happening. And all right, we're going to get into our next segment and talk about the need. And Commissioner Brian Maughan, who's really heading up this search for the money to make this happen for the good of all the citizens of Oklahoma County. And we're so glad to have you. Come back anytime.
Hey, thank you. And thank you for having me on. Have a good night.
Our pleasure. Okay.
Wow.
Mr. Dismukes.
That was, to me, it's really encouraging. There's so many innovative things happening in Oklahoma County. I know they've been working on these issues for a long time, but just to kind of hear everything and a little bit more than just the jail, but everything that's going on and how they're looking at things proactively, it's good. And, there are other communities within the state that are doing similar things. Eventually we'll all get there, right? We'll kind of get everything lined up and be able to take advantage of the opportunities that are out there, especially around the criminal justice system. We've talked a lot about criminal justice and the relationship to behavioral health. I know that's been a big topic at the jail. We have people that I know of who have been involved with many of those discussions as they plan going forward. Of course, all the things that they've had going with maps and everything else that's moving forward. So it's encouraging as someone who lives in the metro, don't live in Oklahoma City, but I spend a great deal of my time in Oklahoma City. So it's an adopted home also. Really
one of those red school guys.
Yeah, one of those red school. I'll keep down here. Hi to Norman.
Why don't you introduce our next two guests? They need no introduction, but we're going to get to why we have to get this done and why it's in the best interest of everybody in Oklahoma County to get this done.
Well, and speaking about people who have been involved in a lot of the things going in discussions around this, we have with us tonight Randy Tate, he's CEO of Northcare, and Connie Schlittler, who's the Vice President of Growth for Northcare. Both were called last minute on this to ask to come in, so thank you for joining us tonight and helping with this discussion and kind of talking about it. You guys, I think, heard the interview with Commissioner and kind of what he was talking about with the jail and a lot of the challenges that they're having, which is unfortunate. But it is important. One of the things he did bring up in that and that Scott brought up in that discussion was that relationship to behavioral health. The fact that they are thinking about behavioral health as they're looking at this new facility. We talk a lot about it, and I know both of you guys have been very involved in some of the discussion as we move forward, not just with the jail, but activities and things that we can do criminal justice wise in Oklahoma County and across the state. And why don't you tell us a little bit about where you are, what's happening now, and let's talk about opportunities in the future.
Thank you, Jeff and Scott, for having Connie and I on your program. Our primary footing is on the jail diversion side and trying to create opportunities for people to stay out of jail. And we're using the situation of ARPA funds and other kinds of funds to try to bolster our efforts. Very targeted to create programs and resources so that we can reduce the number of people going to jail in the first place. So in this period, we've began work on 2 urgent cares. one in Guthrie and one in Edmond. These are both we purchased a building in Edmond and we're renting space in the Guthrie Hospital to create urgent cares. And these are going to be services that are open 24/7, 365, and that law enforcement can bring individuals to, or they can just simply show up without referral even once they're opened. We're also kicking the tires on Oklahoma City, and we have an eye for trying to do something that would make a major difference in the population of the Oklahoma County Jail. We spent a great deal of time with the Commissioner of Mental Health just yesterday in doing some long-range planning on a full series or continuum of addiction treatment services that we feel like could help reduce a lot of the individuals who are in the jail and give them opportunities to get treatment in the community and live in the community as opposed to jail. Additionally, we received a federal grant that Connie headed up, and we are calling this program Champions. And so we're looking to be an alternative to police calls and going out when people have mental health crises. And we also know that the mental health department's issuing another bid for similar opportunities for behavioral health providers to go out in the upcoming 988 mental health crisis line that will be going live federally July 1st. So these are things that we're doing, as well as mental health court, drug court, and various other alternative court situations in which we try to provide services that help people get out of jail, find recovery, and not recidivate back into jail time.
Yeah, you brought up many different things in there that are things that I think are of interest and that we've been talking about. Let me back up just a little bit for people who aren't familiar with Northcare. Tell us about what Northcare does, and I want you to talk about. So when we talked earlier, we were all visiting, and I keep throwing out acronyms. CCBHC. I'd kind of like you to touch on that a little bit and the changes that have happened, not just with Northcare, but with behavioral health across the state, and what that really means for the community. I'm very excited about the opportunity that groups like Northcare are able to, or the difference that they're able to make within the community and with the overall health of individuals.
So, there have been some major changes statutorily in behavioral health, and we are using those changes to step up and elevate the services from where they have been traditionally. In 2014, the Mental Health Excellence Act passed Congress. It was supported by both parties and signed into law by President Obama. It remains to have high level of bipartisan support. And in this act, new organizations were created, and the acronym CCBHC has replaced our traditional term of CMHC, or Community Mental Health Centers. And Oklahoma had 3 pilot CCBHCs that went on April 1st of 2017. May have been 2016 now. This pilot has now been renewed a couple of times, but what's really special about it now is that it's a Medicaid program. And when Oklahoma expanded Medicaid in July, now this Medicaid program has the opportunity to scale up and do more work with more vulnerable populations. One of the things the CCBHC does is it takes evidence-based programming to scale. And so traditionally, CMHC may have had a special grant for one thing or another. But if you weren't able to get into that special grant, you may not get those services. Within a CCBHC, we've made a determination that certain elements or benefits are needed by everybody. So everybody that comes into the service should get that. And we have an eye for certain populations: jail diversion, military, veterans, LGBT communities, and others, particularly disenfranchised communities. CCBHCs are stepping up and looking to provide more value, and particularly with vulnerable populations. And the jail population is one that we certainly have identified as an area that we want to have an impact.
So, Connie, I've kind of touched on this, and I'm moving back towards kind of our criminal justice discussion a little bit. When I think about CCBHCs, which, by the way, I tell everybody that Northcare is one of the inventors of CCBHCs. I know I'm stretching it just a little bit, but you guys were part of that demonstration grant that has shown that this works, and now it's taking off across the country. I just spoke with someone in Louisiana a couple of weeks ago, and he was asking me about it, and I told him what was going on, and they're very interested in pursuing some different things. So there's a lot of opportunity around this. There's innovative things happening in Oklahoma. Certainly Northcare is part of it. But when we look at this too, I talk about the ability and the innovation that's going on as far as partnerships in the community, the ability to really kind of rethink how we're delivering services, which I do think ties back to everything happening within the criminal justice system, looking at different opportunity. But that's that area of growth. And Connie, you're vice president of growth. So you have kind of, that direction that you're going here. Talk about what those opportunities are in that expanded partnership.
I think all of us are learning and have learned a lot in this conversation about defund the police, right? I didn't know what that meant. I started hearing the topic and the George Floyd protests and thinking, well, what does that mean? And then hearing about these police alternative programs like Cahoots in Portland, Oregon is what we based our grant on. Randy and I visited the Denver Star program this past summer, where police calls, like 9 out of 10 police calls are nonviolent calls. That's a lot. That's a lot that may be able to be responded to by folks besides the police department. So I think understanding that the police throughout the country have become the frontline workers for mental health. That's a shame. I started out as a case manager in South Oklahoma City. Randy worked in the state hospital in Norman. I mean, it's sad that the police are dealing with those issues that we once dealt with earlier in our career. So I think the movement is really trying to take that ground back and say, these are not issues that the police are, when we talk to Oklahoma City Police Department, they're not interested in dealing with some of these issues. They care about people. They want to help people, but their job is not to get a bag of groceries, but they do. Their job is not driving someone to an AA meeting, but they probably do. I mean, just frankly, our police are helpers in the community, but mental health centers are really more geared to those kinds of activities. So to me, that's really the future I see us going into. We still have a lot of people every day that walk into services. There's a lot of people in Oklahoma County that don't know about Northcare. They don't know about Red Rock or Hope in Oklahoma County, and they desperately need those services. But we're a little bit different. We're off the grid for some folks, and they may not even know they have mental health issues until a police officer shows up at their door because their neighbors have been complaining about unrepaired windows or a house that's fallen into disrepair and starting to get complaints from the neighbors. That becomes the first alert that this family needs help. So we've started a project a couple years ago where we're just dealing with non-emergency issues, back to the groceries or children that need to be in school or a family that just needs some some help. And there was a lady with a broken window and she was going to be evicted. Folks called 911, the police responded, and then we put together a team with Department of Human Services to really go in and help the lady. She had a son with autism. I mean, those are just basic case management things that we deal with at the Department of Mental Health all the time. And it's a shame that officers are really pulled off of what they've been mandated to do to deal with those kinds of broken window. I call it the broken window story. It's a different one than we think about with the police. But sometimes basic things are causing people to be evicted. Their neighbors get concerned. They call 911. And we know in July we'll have 988 for mental health emergencies. And all of the state, including Northcare, is getting ready with the urgent cares, mobile crisis teams that we have through the federal grant. Hopefully we'll have some state funds for that. Because what we need is a really good 24/7 response where police are not having to deal with all of those issues on their own. So I would say that's, as I talk about the future, that's the future of community mental health, I think, is really taking back the ground on those emergency calls and those 911 calls.
Right. Yeah. And it goes back to innovation. So my previous life before behavioral health was actually with the Department of Justice and working with law enforcement. And we talked about a lot of the things that we were moving towards. And when I came into behavioral health, frankly, so I'm somebody, and I know you are also, who can talk about where we were 20 years ago and where we are now, and it's night and day. The system was absolutely lagging, and a lot of people made a difference with that by going out and advocating for change. In Oklahoma, it's been incredible what we've seen here. A national leader in many of the program areas when we look at the diversion opportunities with the treatment courts especially, but everything else that's happened with the iPads and the mobile crisis, and of course with what you guys have been doing and kind of changing the way the services are delivered. There is a Channel 6 in Tulsa ran a story about one of your peer agencies, Grand Lake Behavioral Health, and some of the things going on. And I think we have it queued up where we can go ahead and play that. I'd like to watch this and maybe talk about that in just a second.
All right, this is from Channel 6 earlier today. Just about a minute and a half story. Here we go.
For a major honor for the Rogers County Undersheriff for creating a mental health program. That program for inmates may now be used all around the country. Thank you for joining us this afternoon. I'm Brian Dorman.
And I'm Shannon Brousseau. The Grand Lake Mental Health Center just named Undersheriff John Sappington the Law Enforcement Administrator of the Year. News on 6's Jordan Tidwell is live at the top of 4 with how they're trying to change the way jails deal with mentally ill inmates. Jordan?
Brian, Shannon, the Grand Lake Mental Health Center says Undersheriff John Sappington refuses to take no for an answer when it comes to getting people the help they need. Grand Lake Mental Health Center COO Josh Cantwell describes Rogers County Undersheriff John Sappington as tenacious.
John Sappington has been crucial in helping us to develop those partnerships and processes to put those things in place in Rogers County.
Cantwell says that's one of the many reasons Sappington was named the Law Enforcement Administrator of the Year. He says Sappington helped implement different programs in the jail, like helping people get proper treatment, providing crisis intervention for people before they even get to jail, and providing support for detention officers.
What happens is people escalate to a point of crisis, and that creates a situation where a disproportionate amount of resources has to be dedicated to those individuals, which really puts the other operations of the facility on the back burner.
Grand Lake Mental Health serves 12 counties in Oklahoma and often partners with law enforcement. Sappington says one of his goals is to help set people up for success when they're released from jail, like helping them get job interviews.
And our goal here is just to provide services sooner and more efficiently, so when they do get released, they'll have a less likely chance to come back.
He says the county has seen a big increase in mental health needs, and he's continuing to push the boundaries to get them help, which makes it better for the inmates, the detention officers, and ultimately citizens.
It's giving them the tools and the resources they need to adequately do their job. And this award is a very humbling award, and I'm grateful for the opportunity.
In Claremore, Jordan Tidwell, Oklahoma Zone, News on 6.
So that story is such a change from really what wasn't that long ago, into how we have law enforcement. Everybody understands. They're looking at individuals as people, understanding illness, understanding disease, and really being proactive. But he brings up a really interesting point when we talk about a couple of things with what's happening with the jail. Certainly there's diversion and trying to keep people from ever getting there to begin with. And those are very important programs. But there's also the aspect of those in jail. And I also think about a little bit about the confusion maybe with the public on what we're talking about as far as populations and the differences as far as within the jails. You do have, you might help explain this a little more. I don't know if I do a good job of it, but I talk about the populations that are eligible for diversion programs, and that really they're there because of untreated mental illness and or addiction issues, often nonviolent crimes, kind of what they mentioned in the story, people that we can divert. But then there's also a population that is in need of treatment, that their disease might not be the primary reason they're there, but it's important to ensure that they're receiving proper treatment. So talk a little bit about that and maybe some of the opportunities, and I'll help fill in too, but some of the opportunities that are out there as far as tools that we have to kind of identify those who would best be able to benefit from diversion.
Randy, you want to do that?
Well,
talk about our offender screenings.
Sure. So one of the things that I think is certainly a place to start are the high utilizers, which we've defined as individuals who've been detained 6 or more times within a 3-year period. We recently became aware of that report, and on its first run, there were 1,159 individuals who were considered. Now, that information has changed with additional reviews, but what it does tell me is these were not individuals that were that were felony charges or other things. These were probably individuals who looked a lot like people I worked with at the state hospital back in the early 80s. These are people who may need support and structure just to keep a roof over their head, their basic needs met, and a home to live in. You know, Dan Strawn from the Homeless Alliance, I'll quote him. He says, you know, a lot of us that have homes hide things that get people that are homeless in trouble with law enforcement, because we can do that behind our closed doors, and these are not things known to the public. Well, I'm not admitting anything, but I think he's right. I think that probably people that are living on the streets and in camps and other things probably bring more attention to themselves than those of us who have live under a roof. And so we want to do what we can to really also link with providers of resources of needs. I mean, we have a crisis of resources as well as mental health and addiction issues and et cetera. So we've got to really kind of pull all this together. But I think the high utilizers are certainly something that has my attention as an excellent place to start and to focus. There are, of course, many other initiatives as well.
Yeah, I think that's one of the things when we talk about the screening programs and some of those resources that are out there in many cases. And so you talk about the individuals who are coming back multiple times, the high utilizers, and identifying that. Many of those people have never engaged with services to begin with. And so the opportunity that we have in thinking differently about how we work within this system and utilize the system, that we have an opportunity there to screen, see if there are behavioral health issues, if there's low criminogenic risk, if there's high need for services, and the possibility that by accessing those services, we can stop that chain of moving, coming back and forth through the system. There's some real opportunity there to get people engaged, which goes back to the innovative things that we were kind of talking about and what you're doing with outreach into the communities, trying to engage those people early in those treatment processes, and finding ways to link people to services so that we can stop or lower the incarceration rates, but also stop these cycles of opportunity or of negative consequences that are going on. There was another story that was run. I wanted to get this on with Channel 9 real quick, that looked at Cleveland County, which I have to brag about Cleveland County and everything I can do to bring attention down here. But looking at something going on in Cleveland County that I thought was particularly innovative and kind of bringing a discussion back to opportunities within the jail. And if you have that, Scott, can we cue it up? And Scott's on mute.
Queuing this up right here. And this is about tech, what they're doing in Cleveland County in the detention facility down here.
There is new technology at a Metro jail that staff says will help keep patients, or inmates rather, alive. The technology is something you may have on your wrist right now. News 9's Angelicia Bruton is in Norman with the story.
The Cleveland County Sheriff's Office is implementing a new product here at the detention center to help monitor inmates. They're hoping that new technology will help prevent inmate deaths. Cleveland County Sheriff's Office says there hasn't been any inmate deaths this year, and they're hoping to keep it that way.
2021, we only had one in custody death, and for us, that's too many. We want to make sure that that does not happen within our custody.
The Sheriff's Office says its new heart rate monitors will help bring that number to zero. Detainees will wear the monitor on either their ankle or wrist.
And it will only be used for those inmates who are considered critical or needing of extra monitoring due to substance abuse or suicidal thoughts or ideations.
Detention centers in neighboring counties like Oklahoma County are looking into new resources as well. There have been 5 in-custody deaths at the Oklahoma County Detention Center this year. A spokesperson for that jail told News 9, "We recently purchased a body scanner which will identify foreign objects, such as drugs on or inside someone being booked into the jail. Identifying and confiscating contraband at intake keeps detainees as well as staff safe from a potential overdose or exposure." Back in Cleveland County, deputies are now learning how to use software on iPads to operate the new system.
If there are any fluctuations or anything that is showing signs of distress, it alerts our staff to go and check on the individual.
The Sheriff's Office plans to start using the new system in the next 6 months. In Cleveland County, Angelicia Bruton, Oklahoma's Own, News 9.
So there's your tech coming into it. All this stuff keeps developing and being utilized.
Yeah, and that's a big thing. The reason I thought that was so important, because tech's been a huge tool as we move forward in behavioral health. Also, it brings out that bit of discussion about within the jail, the being able to maintain the services within the jail, and maybe reaching out and working with the different groups, the partners in behavioral health and other areas, to really help design that jail in a way that makes sense.
Mm-hmm. Mm-hmm. You know, one of the challenges we've had is just the staffing at the Oklahoma County Detention Center is such that we have a hard time getting people that are detained there down to our staff where we can actually evaluate them. So I know there's been a lot of efforts, as Scott said, with the Criminal Justice Advisory Council. You know, Tim Tardebono really has worked tirelessly to get services coordinated and figured out, and he's working to really, it is heartbreaking. And I think especially as we come off this 2 years of COVID, hopefully we're off of COVID from now on, but just really difficulty with getting people out of the detention center and into services. It's been much more challenging these last 24 months. So I think technology is one of the things that we're working on to really, where you don't have as much staff that have to go up and down those elevators at the detention center to bring someone down for an evaluation. But we know the design of the new facility would be a much more amenable to transport and getting people into mental health services while they're incarcerated. So Randy and I are both, I'll speak for Randy, very supportive of the new detention center, and any way we can support that activity of the county commissioners. We really want to help with that.
So, Randy, hope. Is there hope as we move forward? Are we going in
There's
the
always
right
hope.
direction?
So, yeah, I think that we really do need a new facility, and I think that a good design would make a huge difference in the humanity and experience of being in a jail. And I don't think we have that in the current facility. And I hope that that would be brought to bear in its new design. Also, I'm particularly interested in a mental health treatment area of that design. And, I have my druthers that the mental health treatment area of a new jail happens on the outside of the jail and maybe under some kind of conditional bond scenario where federal dollars like Medicaid can be utilized for care and services and not pure state dollars that our county would have to bear. So if those kinds of scenarios and thinking can happen so that we can utilize other dollars, I think then the treatment of inmates improves significantly because we have more resources and our opportunity for more hopeful outcomes is enhanced.
So what's the Randy Tate vision moving forward?
Oh gosh, well, I would just say I want to ensure that we reduce to the smallest number possible people that are in jail, that we reduce the number of deaths in the jail, and that we ensure that those inmates with mental health issues in the jail that cannot be released get the care they need, and that we help not only get people out into alternative programs, but keep them from going in the jail in the first place, and that we help move more and more people into recovery and be able to access their basic needs so that they can live their best possible lives in the community.
We're back on mute, Scott.
It's the sixth time this week I've done that. I'm going to blame that on Suitor Veteran. I had this last one for Connie, where she said, we're over this. Headline AP tonight. A surge in coronavirus infections in Western Europe as experts and health authorities on alert for another wave of the pandemic in the U.S.
Yeah, I did see that. I saw that headline, but I didn't read the story.
Cue the weatherman song from Groundhog Day. It just goes on. And which, by the way, we're just a little over 60% vaccination in Oklahoma. Need I say more? So that's just, it's never going to get done until we listen to the science on this. And there's still too much room for folks out there that are not vaccinated and not boosted for this stuff to replicate into nasty little mutants. It's just, it is what it is. After 2 years, what are we going to do? Which, by the way, I may have said this to you, Jeff, but Monday night, I think, was our 2-year anniversary of the first live stream we did from Tower Theater at the start of COVID. It happened 5 days after the Thunder Utah game was canceled, and we did 60 straight days with Ryan Welton, the folks at News 9 News on 6 from Tower, and we 60 days. Joey, my 21-year-old, who was helping me at the time on this, said, Dad, you're crazy. We'll go ahead and do it. And I said, 60 days, man. It'll be over by then.
I thought it would last 2 weeks, Scott.
I'm the same way. I thought it would be over by now. But this has been a great discussion, a great conversation. We try to have better conversations, and I think it's not great the way we started off this evening. I have great faith in the leadership with the jail trust, all the organizations that are working, the community leaders. It's just been an effort, and the goal is pretty close. People can see the goal, and as we've said, I think, Randy, you just said it, we've got to have a new facility. I mean, if we want to get to the next step, we've got to have that new facility. And by the way, hats off to the folks at county that have done what they've done with the current facility. Okay. And I know they took a lot of heat over getting some of the ARPA money to put into that old jail. And there was some bad coverage of that going, why are you spending money on this? But the improvements have been made, but it's just not, from everybody we've interviewed, Jeff, nobody has said this is a stopgap. Nobody said this can be a long-term solution. If you really do believe in criminal justice reform. And by the way, just a final question for everybody. Are you enjoying the criminal justice reform, mental health issues debate that are being done on 30-second commercials right now? Attacking the governor, ads supporting the governor, 30-second ads.
Right? Scott, you're the only thing I watch on cable TV.
It's quite amazing. And by the way, the facts in a 30-second ad are hard to verify. Okay, it's just hard. I want to thank Randy Tate and Connie Schlittler from Northcare. You folks do great work over there. Great work. And I've been doing it a long time and appreciate everything you do. And as always, Jeff Dismukes, who is a Dodger fan and is very happy baseball is back. So we'll be seeing how that works out. I do not want the Dodgers to get Freddie Freeman, but that's a conversation for another time. As I watch my team, the Reds get dismantled again. So we're a AAA team playing major league prices this year. And thank you to Commissioner Maughan and all the folks that are working to get this done. We are going to keep covering this because we need to. It affects so many lives. It's an important issue, and we're happy to be here. And I really do appreciate the input from Jeff, who is taking time twice a month now for Health Watch to do behavioral health. This goes back to the early days when Doctors Armitage and Bookman and Chansholm and Sublett were saying, Connie, as we were coming out of the first wave, you know, we've got a lot of things that are happening out there that have gone untreated, undiagnosed. And these 4 MDs were saying, we've got to turn to what's happening to our state in terms of mental health.
Right.
And they demanded, we have to start covering this issue because so many people were not tending to business on that. And that's what we've been doing. We're hopeful that we're keeping Doctors Bookman, Chansholm, Sublett, and Armitage happy with what we're doing every other week. And thanks to Jeff for participating in that. We couldn't do it without him and ODMHSAS. Talk about an acronym from the long road there. So, right. All right, we'll see you Saturday morning. We now have a new 10 a.m. live stream with News 9 News on 6. We're going to be covering issues at 10 a.m. and our Wednesday night streams and something special. We'll try to cover that as well on the digital frontier. So on behalf of our panelists tonight, I'll bid you a good evening. We'll see you soon.
Thank
good
you.
Night now.
Thank you, Scott, for including this.
We appreciate
it. And Jeff. And thank you, Connie.